Health Check is presented by
Island Cancer Center.
This morning at the Westin Resort Guam in Tumon, the Department of Public Health and Social Services, in collaboration with the Non-Communicable Disease Consortium, distributed the first ever salt reduction Trifold table displays at Taste Restaurant. High salt intake is attributed to the high incidence of chronic diseases such as hypertension, cardiovascular disease, stroke, cancer, etc. in our community, with heart disease being the #1 cause of death on Guam.
1, 2, 3.
Ruby Gonzalez is a local project associate with the racial and ethnic approach to community health.
Westin is one of our first supporters on our salt reduction initiative. Technically, it's just a simple initiative of the restaurants removing the salt shakers in their tables.
According to Gonzalez, the trifolds will be given to the food establishments who are committed to take the pledge and implement the salt reduction initiative.
We are hoping to have a behavioral modification because if the customers don't see the salt shakers, and we're hoping that if they won't remember it, maybe they won't have to add it. And this is generally to lessen the non-communicable diseases that are related to high salt intake. The salt reduction trifold is what would give the restaurants, in replacement of the salt that they take out. The salt reduction trifold contains the information of the benefits of reducing the salts in our diets. Just as simple as that.
The World Health Organization recommends a maximum of 5 grams or 1 teaspoon of salt intake daily. Gonzalez adds that Westin Resort Guam was not only one of the first who supported the initiative, but they have been working hand in hand with the NCDC to help make a healthier Guam. Executive Chef for Westin Resort Guam, Daniel Lanier.
It's important that we take initiative to support local health like that, and because high blood pressure, heart disease, it's all connected with salt intake as well. So that's why we took the step and removed all salt shakers from Taste Restaurant.
The initiative suggests that all salt shakers are removed from the tables, and other salt products like soy sauce, fenadeni, fish sauce are available upon the customer's request only.
We were surprised. Nearly nobody. Very few people ask for extra salt. So it is, when the salt shaker is on the table, a lot of people they take first and put salt before they even try. So, which makes the salt intake, the extra salt intake, very, very high. So, but I mean, we already, as chefs, we already taste our food and what we cook, and it's normally a good season. So, this helps immensely to reduce the salt intake.
Food establishments are highly encouraged to support and join this campaign to push the implementation of the Salt Reduction Initiative. For more information, you can call the Bureau of Community Health Services at 735-7336. With this week's Health Check report, I'm Jonah Gancharfis.
Health Check is presented by
Island Cancer Center.